Hey everyone, I'm Ashley McGee, and I am super excited to be joined by Laquista Erinna, a therapist, military veteran, and she's here to talk health, wellness, mental health, and I'm super excited to have her. Thank you so much for being here.
No, thank you, Ashley, for having me. I'm so excited to be here as well.
So I spoiled it a little bit, but I do always like to start by asking my guests, what is your connection to the military?
Oh yes. So my connection to the military. So I am a Army veteran. I've been in the military for about 21 years.
Wow.
Started out as a reservist, deployed 2 times to Iraq, and then I went AGR, Active Guard Reserves, and then back to the reserves. And finally, I'm at retirement. So my retirement packet is up. So technically, I'm still in the reserves, Army Reserves, but
Mhm.
that retirement packet is up, and I'm just super excited to start this next chapter. I'm also a former military spouse, so my ex-husband was active duty, well, AGR as well, and so military has just kind of been like in my life. My mom was in the military, so I
Mm,
kind of carried that tradition. And now
I love that.
my middle sister, went active duty a couple years ago. So I'm super proud of her.
That's so cool. Also, I have to say, like, I cannot believe you're at over 20 years. You look incredible.
I was a baby when I joined. I joined. My mom had to sign for me because I wasn't 18 yet.
Oh,
And so,
wow.
yeah, the time goes by really fast.
Yeah, that's incredible. I remember at the very beginning of my career, I immediately started investing in like good skincare because I was like, I'm never gonna let the Navy show on my face.
Well, you look good too. Shoot.
Thank you. I'm only at about 10 years at this point, but yeah, it's all good fun. So you've transitioned now and you have your own practice as a therapist, right?
Correct. I left active duty AGR in 2017, the
Mm-hmm.
same time my ex-husband and I got PCS orders to Fort Dix, New Jersey. And so in that transition, I didn't have a job, wasn't looking for a job, wasn't interested. I was completing my doctorate program, and I was like, well, let me just try. Like, I don't really
Mm.
want to like find a job, but there was actually, it's a funny story. It was I saw an advertisement. If Fort Dix is in New Jersey, so
Of
it's like in the middle of nowhere. And I saw a job
course.
posting for psychological health outreach on Fort Dix with the
Mm-hmm.
Navy
Mm-hmm.
and Marines. And I was like, I'm just gonna apply, just, so my husband will think, I'm like really trying to find a job. And I'm like, they're never gonna call me. And what happened was they called me, and the job was just too perfect to kind of turn down. I got to work remotely like 2 to 3 days a week. It was working with Navy and Marine reservists, connecting them to mental health and services in the community. And I was like, okay, I can do this, and like this can fund my private practice.
Mm.
Same time, I found an office. So the stars were aligned. Like, I
Wow.
got the blessings from the heavens, and I was like, okay, it's go time. And I sat there, started my private practice for 6 months, and I maybe had like 2 clients. Like, I was like, what is going on here? Like, I had no idea about starting a business. Like, you go to school, they teach you about therapy, they teach you how to do these things, but they don't
Mm.
teach you how to do a business. So um,
Yep.
it was very interesting, and I think with my training wheels on, I kind of found my way and was able to kind of turn it around to a successful practice. I was full, and had plenty of clients and was doing really well. So yeah, I've learned a lot along the way, but it is difficult being a military spouse, active duty family, trying to start a business, and just
Mm-hmm.
balance. And on top of that, complete my doctorate program. So yeah, I was all over
Yeah,
the place.
that's a lot to balance.
Yeah.
Absolutely. So how were you like initially attracted to mental health and therapy? Is there something like in your background, or were you just always kind of drawn to help people that way?
Yeah, I think I've always been like a helper. Um, I actually, after my first deployment to Iraq, when I came back, so this is like 2003 when like everything was really kicking off, and
Mm-hmm.
my job was postal, which wouldn't seem like dangerous job, but if you think about it, everyone needs and wants their mail. And so we were one of the first ones out. Like, we didn't have running water, we didn't have toilets,
Oh
we
my
had
gosh.
nothing, and it was horrible. And I just remember my unit, like we were all so young, like babies, like 20 and below, going over here. And a lot of us kind of struggled when we came back. We saw a lot of things. And so I lost a couple friends to suicide and just mental illness. And I knew
Mm-hmm.
I didn't want that for
Mm-hmm.
myself. And I didn't want to continue to see friends go.
Yeah.
And it wasn't actually until like my second deployment, I went back to the same war in 2007. I was
Mm-hmm.
like, yeah, this is difficult. Like this cycle is going to continue. Like, we're going in and out, and people aren't talking, especially like veterans, military, that stigma surrounding it.
Mm-hmm.
And so when
Mm-hmm.
I came back the second time, you know, I had a young son, I had a husband who I had left for like a year, and I was diagnosed with PTSD, anxiety and depression, and I didn't know what to do. And I
Mm-hmm.
went to the VA and got help from a social worker. I was going to the vet centers, working with a social worker, and it really kind of changed my life around. And at that point I said, okay, I'm going to get my master's in social work, because me as a veteran, I know I can connect to other people who understand, because, you know, as being in the Navy, like it's something about talking to someone who really understands like your unique circumstances. And
Absolutely.
so USC had an amazing online program, master's program for social work, and they had a emphasis on military and veteran services. And
Mm-hmm.
so that's how I kind of got into that. And for whatever reason, like people always like to come sit in my office, like even before I went into therapy, and just tell me all their stuff. I don't know why they think I have such great advice, which therapy is not advice. It is actual evidence-based, like work that we do, but people just seem to open up to me. And I think, you know, just having that rapport and that camaraderie with this
Mm-hmm.
community, you know, just made
Mm-hmm.
it a natural fit.
I love that. Yeah, I imagine that it's helpful to have an ally, right? Because so often, there's so many myths and stigmas about, you know, if you seek any sort of mental health care, it's going to affect your career. I'm dual military as well. My husband is a pilot, and like, good God, getting aviators to go to the doctor is
Oh, yes.
flippin' ridiculous.
Yes. Yes.
Like, and he's getting close to retirement. So I'm like, okay, now you have to get all of this stuff documented for the VA. Like, you have to do this.
Yes,
But
absolutely.
yeah, so how how have you found, like, what's the best way to help people kind of overcome that stigma, or break through the myths regarding mental health, especially alongside like military service, or even being, you know, in the spouse community as well?
Right. And I think there is a big push, especially now with COVID and so many people kind of, you know, struggling with anxiety and the
Mm-hmm.
fear of the unknown, and all of these things are outside of our control, that
Yeah.
it's okay to talk to someone. So I always, when someone calls my office or sends me an email, even if I'm full, because I'm currently full right now, I always say, good for you. Like taking this first step and just
Mm-hmm.
calling and inquiring about services. Like I know that was a big thing, especially like
Mm-hmm.
in the Black community. I mean, I don't know if you could tell, but I'm a Black woman, and in our community, it is so incredibly hard
Mm-hmm.
to break down those walls of that stigma and to
Mm-hmm.
seek mental health treatment, because we're taught the same as in the military. So it's like this parallel that you keep your business to yourself. You
Mm-hmm.
don't talk about these things. Like you said, like it can affect your career,
Mm-hmm.
being in the military. But I think it's more leaders who have been in for, several years. They're starting to recognize that. And I think the new generation of military service members, they're pretty much all in. This generation they're all in about therapy. So when I was working the PHOP program, which is the psychological health outreach program,
Mm-hmm.
the young military service members, Marines, Navy, they would come to my office and they would say, "Hey, I need help." And if you think about a young Marine coming to get mental health treatment or to
Yeah.
say, "Hey, I need help," that's a big deal. And
Yeah.
I think part of that actually comes from their leadership saying, "Hey,
Mm-hmm.
it's okay." Like back in the day when I was like your age, like that was a no-no, because it
Yeah.
was a showstopper for your career. And like with your husband being a pilot, like I
Mm-hmm.
definitely understand they don't want to do anything that's
Nope.
gonna prevent them from um, being able to fly. And I actually work with a lot of wing units, and so it it I think, just educating, talking about it more,
Mm-hmm.
the military spouse community as well. I see so many spouses just searching for something,
Mm-hmm.
searching for that friend that, we're moving constantly from PCSing from place to place. You have to kind of start over, build these friendships and these bonds. You may be isolated from like your families.
Mm-hmm.
Your spouse may be deployed and you're home with these children and don't have that support. So finding someone you can kind of talk to and what you trust. So if not a mental health professional, like having that network community. So getting involved in your local community, a lot of these spouse organizations, or, just whatever you have on your base.
Yeah.
Finding out what services are available. I find that a lot of people don't even know that they have access to mental health treatment
Mm-hmm.
uh, outside of, TRICARE, which TRICARE does cover mental health therapy, and you can do telehealth, so you don't actually have to get up and leave your home. So if you have children, have all these things, you can do it remotely, just how we're doing now. You're in
Yeah.
California and I'm here in Georgia. So there's so many different resources out there. So knowing what's available, talking to like the people you trust, and then, just, creating that balance like in your life, like putting yourself first. So
Mm-hmm.
self-care is not selfish.
Mm-hmm.
And we
Yes.
tend, yes, yes, girl. And what we tend to do is we take care of everybody else, but we don't take care of ourselves.
Mm-hmm.
And so when you get on an airplane, the first thing they tell you when they're doing the announcements is put your mask on first before you assist anyone else, even small
Mm-hmm.
children. Because if you're passed out, your child gonna pass out too, because I
Mm-hmm.
mean, who's gonna help them at that point? And so it's the same thing like in your life. You cannot do it all at the same time. It's just impossible.
Yeah, absolutely. Yeah, you can't pour from an empty cup, right? And
Right.
it's fascinating to me how quickly we kind of let ourselves, you know, become the back burner priorities. I was actually pleasantly surprised though, talking about the way things are changing in the military. So I just got done with a 5-week school and Navy school. and there was a wellness segment in it. And at one point, you know, the CEO asked like, okay, like, you know, who in here has experience meditating or like meditates regularly? And I practice transcendental meditation. I was 100% expecting to be the only person raising my hand, but there were like, I want to say maybe a third of the class, and I was one of 3 women in the class, right? So the vast majority of the people were, you know, men in the military, and I've never seen a guy, like one of my peers, say, yeah, I practice meditation. It is a lifesaver. I love it. I'm like, this is awesome.
It is. And you know, I think it's going more mainstream, like creating that balance. So like if you notice like the NFL and the NBA, they have actually started, I don't know when it became effective, maybe a couple years back, where all the teams have to have like a mental health professional on staff to help with that. And then when you talk about wellness, like yoga is really huge. I'm actually doing like my yoga teacher certification because they were giving away scholarships through Yoga Alliance to promote like Black wellness in the field. And so due to COVID, and so many people signed up for it. They were so overwhelmed with how many people, but yoga and therapy actually works really well. There are so many therapists who incorporate that into their practice. And that's something I'm looking to do on down the line. You know, I hope to be able to have a full like wellness center. So not only focusing on like the therapy piece, but like the wellness, because, you know, once you're dealing with your stuff, like whatever issue, like, that is kind of bothering you, you have to know how to live well to be able to continue like on your path. And so it's so important that we kind of teach this and teach our babies too, because they're like watching. I'm, you know, and being in the house, I'm like, okay, I need to get my life together, get back in shape, because I admit, like, at the beginning of this pandemic, I was eating up everything, not doing anything but like sleeping and watching Netflix. And I was like, you know what? I feel sluggish. I don't feel good. And so I started back working out, like meditating, journaling, and my 4-year-old, he's right there beside me, like doing it. And so it'll be normal for them growing up as they see us practicing these things.
Yeah, that's huge, thinking about how we're shaping the future generations. And I think that's so cool. You're looking at combining the yoga with your practice because of that, like that mind body connection, right? And we carry so much trauma in our bodies, and we don't even realize it until, you know, you're in downward dog and you start crying.
Yeah, that's one thing that, so with clients, we do like an emotional check-in. Sometimes like, well, it's really hard to do like virtually, but we still try to do it. But when, you know, I had my office, you can kind of just tell that someone is just heavy when they come in, especially if they're coming in for therapy and they're like holding all this stuff inside for a week. I'm like, let's do an emotional check-in. Like, what are you feeling? Oh, I have a headache in my stomach. Like, I haven't been able to eat. Well, where is that coming from? Like, what is kind of going on with you? Because like you said, we carry all this stuff in our bodies. A lot of anxiety translates to a lot of gut issues. So that bubbly stomach, the knots, like all of that, this
which wrecks your immune system.
And so I have to teach clients, you have to pay attention and listen to these signs. So if it's nothing medically wrong with you, it's probably something you're not dealing with that is kind of manifesting physically.
So I do want to ask you, you know, being Black woman, also a woman in the military, and then seeking that treatment, you know, health equity is a huge issue. I'm curious what your experiences were, you know, going through that system, if you felt, you felt seen, if you felt cared for, and how that experience has shaped your practice moving forward.
Right. And I'm so glad you asked that because, you know, health equity, especially with Black women, um, there's this belief, or like the standard in medicine is that, you know, Black women have this high tolerance for pain. And there's been research and, you know, studies to kind of prove that, you know, doctors kind of discount our pleas for help. If you think back to Serena Williams when she had her baby, now this is Serena Williams, like she's telling the people something's not right, something's wrong, and they're, oh, you're fine. You know, they just kind of brush it off. And I absolutely have experienced that in the VA. Fortunately for myself, I'm able to kind of speak up for myself and advocate for myself. Like I know I can go to like a patient advocate. I know I can make noise. I know I can request a different provider. So, but so many people don't know this. They feel like they're just kind of stuck. And it really makes them shut down. And so one particular time I went to the VA, because like I've been very honest about, you know, having PTSD before in the past. And I was just having like a really bad day. It wasn't, you know, I wasn't, you know, suicidal. I didn't say, me as a therapist, I know, you know, I know what constitutes like someone being, needing to be sent for inpatient treatment. And I was just talking to this doctor, this psychiatrist, and I was saying, you know, I'm so overwhelmed. Like I have my son, he has autism, like like it was just one of those days where it was just so overwhelming. And the next thing I know is like 3 people come into the office. And I'm looking and I'm thinking, like, my spidey senses went off. And I'm like, why are these people here? Like, did something happen? And then they start asking me, like, all these questions. I was like, oh, they really think they're going to try to admit me or something. And I was like, no, absolutely not. And I got up and I walked out. And this doctor actually called the cops on me and had them follow me. And at that point I had a panic attack, like full on panic attack. Like, why would you do that? And I couldn't even like wrap my mind around like just doing that to one of my clients. Like I'm very open and communicate, you know, before I make any decisions, like even beforehand, like your safety is always like my concern. But what that showed me was you're not listening to me. I'm telling you, you know, my autistic son is having a moment. He was actually with me at the appointment. Like you can see that I'm overwhelmed. But this is my life. Like I don't need you to feel sorry for me. I don't need you to I did none of that. What you did was you overstepped your boundaries. And I ended up, you know, going to the local mobile crisis team. And I was like, listen, can you put this lady's mind at ease? Like I am not suicidal. I'm not these things. This is what happened. And the intake person who was working with me, she was a social worker, I think, as well. And she was like, well, I was really nervous about coming and talking to you because I would think you would try to get out of it because kind of what I'm going to ask. I was like, no, this is exactly what I said. This is what happened. She was like, yeah, she overreacted. And luckily this was another Black female who actually listened to me. And she was like, you know, this is, you know, why it's so hard for people to want to seek treatment, because people overreact because they know I'm a veteran. They know I have a weapon, like I'm licensed to carry. And you hear weapon, veteran, I'm overwhelmed, and you automatically think, okay, she's gonna do something. You didn't talk to me, you didn't ask the questions. And so I'm very, very protective of my clients. I always let them know that, you know, anything I do is for your safety, but I use my best clinical judgment. And I
Yeah.
talk to you, I'm not going to do anything behind your back. I'm going to let you
Mm-hmm.
know what I'm going to do before I do it. And hopefully we can, you know, work something out, talk about it, talk through it, because just because you're feeling down or
Mm-hmm.
you may have this low moment or feeling hopeless, that doesn't mean you're gonna act upon it or that, you know, you're gonna do something. And a lot of people kind of get
Yeah.
that confused.
Mm-hmm. Well, I think too, in our society is we've gotten in this habit where we don't trust ourselves when it comes to our own health, right? We don't know how to advocate for ourselves. And so it's instead of actually listening, right, we become these just like check in the box, like, okay, do you fit these demographics, or do you fit these, symptoms or whatever? And then, okay, if these boxes are checked, then I do this thing, rather than saying, okay, like, let me actually connect with this person, think about what they need and communicate with them and empower them to be a part of their own healing.
Absolutely. And, you know, it's funny you say that because you know, we had an influx of people seeking therapy during COVID.
Mm-hmm.
And so a lot of the normal like assessments we do to, you know, just assess for like anxiety or depression. I mean, what is going on? Everyone is anxious.
Yeah.
Everyone may fit the criteria of like depression because
Yeah.
we've been in the house since March. And so
Mm-hmm.
I'm like, yeah, you scored really high on this, but outside of this moment, kind of what is going on, because we'll all check all the boxes
Yeah.
just based on COVID
Oh,
alone, based
definitely.
on being in the house, sleeping all the time, like changing appetite, not connecting
Mm-hmm.
with friends. But you have to
Mm-hmm.
think outside of that, like what else is going on? How long has this been going on? Do you think it's just related to COVID, or is it something else? And one
Mm-hmm.
thing that COVID did was it shined a light on a lot of things people weren't dealing with before
Mm-hmm.
because we're so busy. We don't
Yeah.
have that work-life balance. And
Mm-hmm.
so when you're forced to be at home and sit with nothing but your thoughts, you have time to think about some things.
Yeah. Absolutely. I've been finding that too. I've had a couple clients that have had to go, they've either recently deployed, or they're, going to schools or whatever. So they've had to quarantine, and they're like, we're doing
Yep.
mindset work as they're in a 2-week quarantine. They're like, this is really hard.
Yep.
I can't go anywhere. Yeah. Yeah. But it's such important work, and even with as much uncertainty, with everything that's going on in our society right now, I think there's a lot of catalyst for real change that's going to ultimately, benefit our society. I have to have hope in
Yeah.
that. But yeah, it is an interesting time we're living in for sure. But I'm glad that people are finally taking the time to slow down, to reflect and go, okay, maybe there's some things here I need to deal with. And
Right.
understanding too, right? Like when it comes to mental health, when it comes to therapy, like it doesn't mean you're broken. It doesn't mean something's wrong with you. Like we all have stuff that we need to unpack and deal with. It's part of being human.
Right. Absolutely. And a lot of that stuff, I always tell people, I said, stop picking up stuff that don't belong to you. Like
I
you
love
got your
that.
own stuff and you're like picking up all this stuff, like your back is gonna break. Like you have all of this stuff. You haven't even dealt with your own crap.
Mm-hmm.
So stop picking up that stuff. It doesn't belong to you. Like this stuff is outside of your control.
Mm.
Like all of the stuff that happened because of the quarantine, this
Mm-hmm.
pandemic,
Mm-hmm.
we have absolutely no control over it. So,
Ah,
like, don't focus on that. Like, focus on what you can control within yourself. And it's been a struggle for those people who like to be in control. So
Mm-hmm.
not knowing, not being able to plan, like it's hard
Yep.
for a lot of people.
Mm-hmm. Yeah, I'm the extrovert. So like there have been times I've called my husband, I'm like, I am not okay. I think as soon as the quarantine happened, I bought like one of those boyfriend pillows, which is basically a torso with an arm so I could feel
Yeah.
like spooned. Uh, just as a coping mechanism, because I was like, oh, I can't even hug my friends anymore. Like I need something. Yep. But as we kind of wrap up here, I would love to hear, do you have any tips or advice for people that are looking or either curious about therapy or, concerned about impact on their work or, anyone that's kind of looking to get into therapy? I realize that was a terribly worded question, but I'm going to go with it.
Look, it's what, like 7 something your time?
Yeah,
Yeah,
yeah.
see,
I'm
it's
slowly
almost
caffeinating.
lunchtime here. Yeah, it's okay. So if anyone is interested in therapy, like I would say do your research. So there are lots of different directories online where you can kind of find a therapist. You can filter for, race, gender, affiliation, like military. So like a lot of military families want someone who has worked with military or has been in the military before. Black therapists are really big right now because, people want to talk and connect to someone who looks like them. So you're not having to explain like all of the cultural nuances that kind
Yeah.
of go into that, and you feel like someone is actually listening to you.
Yeah.
I think that's great, but there's so many different diverse platforms to search for those things, whatever it may be. If you want a woman, if you want a man, if you want someone who is LGBTQ friendly, you can do that. I would also say don't be afraid to try out a few therapists. So just because you go in for an initial session, it doesn't mean you're stuck with that person. So this is going to be one of the most important relationships and most intimate relationships you will have. So it's really important that you feel comfortable talking to this person. And, if you go and it's not a good fit, it's not a good fit. It's like you both are making sure it's going to be a beneficial relationship. So as therapists, we don't take it personal because this is about you and your journey. So if you need to find someone else, but be honest with yourself. So if you're hopping from therapist to therapist to therapist and you can't really settle on a person, then maybe you need to do some self-reflection and see if you're even ready. So if you're not ready for therapy, it's not going to work. So therapy isn't there to fix you. Like you said, like some people are looking for a fix. It's really like a journey that you're on, and you're just getting the tools you need to be able to kind of process and figure out kind of which direction to go. So a therapist is not going to fix you.
Yeah.
You have to do the work, you have to do the homework. And, if you have any, questions about it, like don't be ashamed to kind of ask and even talk to your friends or trusted individuals about just wanting to go to therapy. You may find that they're feeling the same way. A lot of people feel isolated, like, okay, like no one I know goes to therapy, but it's so many people who have therapists. And if you don't know, you don't know. So just do your research is probably like the biggest concern that I would say needs to be addressed. Because if you're just randomly picking someone just because they happen to be close to like your office, it may not be a good match. Like I'm not a good match for a lot of people, but for some people I'm awesome. Some people we just may not work.
Yeah. I think that's really helpful. I've definitely had experiences where like I, went to therapy and like it wasn't like the best fit. I got out of it, I guess, ultimately what I needed, but yeah, but I like carry that guilt of like, well, I don't want to like ask for someone else, but so yeah, that's really helpful.
Yeah, and just so you know, like most therapists should, you know, be open to like, even if you're uncomfortable with something they say or you feel like you're not getting something from them, they should be okay with you saying that. Because we're human too. Like most therapists I know, myself included, has either been in therapy or currently have a therapist themselves. And so we all, you know, need someone to kind of process these things with. And sometimes, you know, it just may be off, but then like you said, sometimes it may just be, okay, I need a new person. This isn't working for me, but I'm glad to know that you got what you needed to get out of that situation. But don't be afraid next time if you ever find yourself in need to just speak up, or, you know, just say, hey, I want to go with someone else. Or, you know, we get ghosted a lot. I don't take any offense to it. You know, after a couple of sessions, we may get ghosted and then a client will pop back up a few months later. So, I mean, it's just part of human nature, I think.
Yeah. Yeah. Well, thank you again, Laquista, for being on. This has been such a wonderful conversation. If people are looking to, you know, find you, learn more about you, maybe once you're taking clients and not so full, work with you, where can people find you?
So my social media is at Laquista Erinna on all platforms. So Instagram, Facebook, and then my website is laquistaerinna.com, and then laquistaerinnaspeaks.com. So my name is really complicated to spell. I need to figure that out. But at Laquista Erinna, I think I'm the only one. There are lots of Laquistas, but there's only one Laquista Erinna.
Love it. And I will make sure I put it in the show notes. So wherever people are either watching or listening to this, they will be able to find you. But thank you again so much. I really appreciate your, you know, your insights, your wisdom, as well as your honesty and vulnerability. I think this is a really wonderful conversation.
Yeah, I enjoyed it. Thank you so much, Ashley.
Yeah.